A 21-year-old man seeks evaluation at an urgent care clinic because of nausea, vomiting, and abdominal pain that began 2 hours ago. He attended a picnic this afternoon where he ate cheese sandwich and potato salad. He says that a number of his friends who were at the picnic have similar symptoms. His medical history is significant for celiac disease, which is well controlled with a gluten-free diet and an appendectomy that was performed last year. Vital signs include temperature is 98.6, respiratory rate is 15, pulse rate is 97, and blood pressure 98 by 78. He started on intravenous fluids. Which of the following is the most likely cause of the patient's condition? Okay, so yes. Would anyone like to give me a quick diagnosis of which bacteria is being talked about here? Very good. So some of you have answered it. So the bacteria is Staphylococcus aureus, which is a gram-positive, catalase-positive, coagulase-positive bacteria as mentioned over here. Okay. So some things which would have directed you to the answer was basically you should remember one thing, that there are two bacteria which you might have got confused with. One is Bacillus cereus and one is Staphylococcus aureus. These are two bacteria which cause rapid these symptoms rapidly. The symptoms which I mentioned are nausea, vomiting, abdominal pain. Basically, they cause rapid food poisoning, like within 2 hours or something. But one thing which will help you differentiate, like it's mentioned in the question, is like if a patient has a history of cheese, mayonnaise, or potato salad, then it's basically talking about Staphylococcus aureus. And if they talk about reheated rice or something, then they're talking about Bacillus cereus. All right, Bacillus cereus. It is caused by reheated rice. It is a gram-positive bacilli. So I hope everyone is clear when you're talking about a person who comes with a rapid food poisoning that starts quickly and ends quickly also, like it's mentioned here. See, he came to a clinic because of nausea, vomiting, and everything that began within 2 hours. Okay, he attended a picnic just in afternoon. He ate all the stuff and he was started on IV fluids and all. And they might mention in the question now he has recovered within a day or something. So basically, they are trying to direct you towards two bacteria: Staphylococcus aureus, Bacillus cereus. Bacillus cereus, like I told you, gram-positive bacilli, not gram-negative bacilli. Okay, and Staphylococcus aureus is a gram-positive, catalase-positive, coagulase-positive cocci. Okay, and when there's a history of mayonnaise, cheese sandwich, or potato salad and something, they are always referring to your Staph aureus. When they are referring to some kind of case where he had reheated rice, or the rice was kept in a refrigerator and then he heated it again or reheated something like that, they are usually talking about Bacillus cereus. Like someone mentioned over here seafood, so that is why it came to my head. Tell me which bacteria you can get because of contaminated seafood. These are some things which are very peculiar, which will be given in the question. Okay. So it's better you know. For seafood, you usually have Vibrio vulnificus and Vibrio parahemolyticus. Okay, as far as the bacteria are concerned, and as far as your virus are concerned, I think you have hepatitis A, which you get from raw, uncooked shellfish and all that stuff. Okay, so generally it will be mentioned in the question, and they'll obviously give you the features. You can easily differentiate between hepatitis A or Vibrio or something, right? Vibrio has watery diarrhea or something, right? Like someone mentioned listeria. Listeria would be caused by these cheese, meat, and all that stuff. Generally soft cheeses and all. So maybe you might have thought of listeria over here, but the thing is, listeria does not cause rapid food poisoning. It causes a delayed food poisoning. When we talk about rapid, it is only two things. Why it is rapid? Because of the toxin that is involved. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.